Please go ahead, sir. We are live now.
And Jai Hind to everyone. Welcome to another edition of webinars in the series of Illness to Wellness. As you all must be aware that we've been organizing these webinars since almost 2 years. Earlier, these events were organized physically by ASSOCHAM, by their corporate social responsibility wing, in which we used to conduct health camps, health awareness events in different parts of Delhi and other places, creating awareness about non-communicable diseases, especially diabetes, doing free health checkups, and many events were being organized. But due to the COVID, it has not been possible for us to go out to the communities. So we have taken this route of webinars and digitally connecting with you and spreading awareness together with the most eminent specialists, I would say, the stars in their fields in our country. We are gathering them on this platform, on this podium, and they answer your questions, they clear all your doubts, and they respond to whatever queries you have put up in the mails regarding this. So I'd once again welcome you all. I'd like to welcome you on behalf of Sri Anil Rajputji, who is the chairman of CSR committee of ASSOCHAM. ASSOCHAM is the organizer of this series of webinars. Unfortunately, he could not be with us today. So I'd like to welcome you all. I won't be standing between you, between our eminent specialists, our panelists, and the audience. The topic that we are going to touch on today is air pollution and health. Now, this is something that I don't have to tell, I don't even have to introduce, because you actually don't need any words to feel the pollution. It's the air that you're breathing, you're feeling that pollution inside in your nose, in your throat, in your lungs, and you may even be having tears in your eyes when you go out. Not only when you go out, when you just wake up from your bed. So pollution is there, pollution is in the air, and it is adversely affecting the lives of all of us. Air actually is the essence of life. We cannot survive without oxygen, which is there in the air. And what if this air itself, instead of being the essence of life, starts destroying our life? To an extent, it becomes our enemy. So this actually is happening now. Why is it happening? How does it affect our lives, our health? This is going to be the topic of today's discussion. And today we are very fortunate to have very eminent specialists and from different fields of medicine, economy, who are going to discuss topics related to air pollution and who are going to answer your questions. So I would once again like to welcome all of you, and I'm very grateful to Dr. G.C. Khilani, who could find time and join us today here. I'm sure that you would all be aware of Dr. G.C. Khilani. He actually needs no introduction. He is a very famous pulmonologist, a chest specialist, and besides that, he is a prolific speaker, and he's creating a lot of awareness. He's doing a lot of work on on the effects of air pollution and how to prevent that. So Dr. G.C. Khilani is the chairman of PSRI Institute of Pulmonary, Critical Care and Sleep Medicine. He's having more than 4 decades of experience in this field. He was also head of department and professor of pulmonary medicine and sleep disorders in All India Institute of Medical Sciences, New Delhi. He is having expertise in pulmonary and critical care medicine and sleep medicine. He did fellowship in critical care from Mount Sinai Medical School, New York, United States. He has numbers of publications to his credits, and he has number of accolades and awards. And he is himself an editor of many journals. He's been a founder of many societies and member of many international societies. There's a very, very long list. So since he is already so famous and he's so dear to all of us, I would once again like to thank him for joining us, for sparing time to be with us. Thank you so much and welcome once again, Dr. Khilani. And today we have a special guest with us. Uh, we have tried to widen the scope of our discussions, and we are honored to have with us Professor Lalin Prasad. Professor Lalin Prasad ji is a management guru. He's a prolific writer. He's a poet. He's an eminent political and economic analyst and a social activist. He's done his LLB and PhD, and he's a gold medalist from Banaras Hindu University. He's also a Sahitya Ratna awardee. He is also the former dean, professor, founder, and head of Department of Business Economics, Delhi University. He's been a vice chancellor in Jaipuria University and director of Jaipuria Institute of Management. He's been a visiting professor of economics in Moscow State Universities, and he was the principal investigator in a World Bank study on the pollution in Yamuna River Basin in Delhi. He's the author of many textbooks on management, human resources. He's also a poet and a thinker. And needless to say that he has presented many papers in national and international conferences on the field of economics. He's a writer, and his editorials are published almost every other day in major national dailies. You can find them in most of the major newspapers. He's a founder member of many national and international societies. So thank you so much, Professor Alan Prasad, for finding time and for joining us, for being here with us. We also have Dr. Rajiv Chabra. Dr. Chabra has a vast experience in management of neonatal pediatric emergencies, medical and surgical neonatal intensive care, and is NALS and PALS certified. His areas of interest include pediatric oncology, treatment of hemophiliacs and hemofiltration, hemodialysis, peritoneal dialysis for children. Dr. Chabra has been active in the field of community child health and immunization and child health clinics at various schools. He is actively involved in research and academics and has got many publications to his credit. His interests involve taking care of kids with childhood asthma and respiratory disorders. He is advisor to health-based publications. He holds memberships of numerous societies, academic and research institutes. So we are honored to have you here with us, Dr. Chabra. Once again, thank you and welcome to this webinar. So I won't take much time. I won't even give any introduction. Further ahead, we are already well aware of the topic. Recently, I was listening to an interview by our Honorable Dr. Khilani, in which he used the word gas chamber. Actually, this word gas chamber is a dreadful word because it is usually associated with death and destruction. That the Nazis brought, the havoc they brought to the Allies and to the Jews and others using this gas chamber. So it's a symbol of death, actually. So how does the gas chamber correlate to the current situation that we are living in, especially in Delhi? Dr. Khilani, sir. So I think you are muted. We can't hear you, sir. Please unmute yourself.
Okay. Thank you, Dr. Kesari, for having me here once again. Thanks to you, and nobody is better than you in anchoring it. And ASSOCHAM, who is the this title says wellness to illness or illness to wellness. So pollution is from wellness to illness. The gas chamber word that I used. Suppose you were to go in a gas chamber, forget about Nazis. Then you would start, you will be suffocated, you will be coughing, you will be short of breath. So I'll give you an example about in 3-4 years back when I was working in AIMS, one of my professor colleague, about 50 years old, he came to my OPD and he said, Dr. Kilnani, I got up 4 o'clock in the morning. This was November, close to Diwali. And I don't have any asthma, bronchitis, I'm a non-smoker, but at 4 o'clock I got up, I couldn't breathe, I was wheezing, there was severe soreness in my throat, and I just sat down and I had some water and it took me some time to get my breath. Isn't it a gas chamber?
Yeah.
And about half an hour back, and I was sitting in my OPD in PSRI, One 37 years old male who had had COVID in May with mild COVID, with no CT changes, he had the same symptoms. So, daily people have got used to this fait accompli, that October, November will come, Diwali will come. We'll get up in the morning, we'll feel our throat will be dry, we'll be choking, there'll be tightness in the chest, the eyes will be smarting, there may be watering, which you call tears. There may be itching in the skin. In the evening, we'll feel tired. Appetite will be slightly low. Little bit of depression, little bit of headache, little bit of sleep disturbances. This is what is we are suffering from every year. And that's what I call this gas chamber, because everybody is breathing a gas which is noxious, which is toxic. It not only affects our immediate health in the sense that we feel unwell, but the data says the life expectancy goes down by 8 years. So when the life expectancy goes down by 8 years, that means you have several diseases, starting from bronchitis, which is the lung involvement is in 43% cases. But what about other diseases? Heart attacks, coronary artery disease, strokes, variety of cancers. All those things are caused by air pollution, and I can go on talking about it as we discuss. So, we are in trouble for not today, for several years, and as we go on, we'll discuss as to how the COVID has affected further as far as air pollution is concerned. So, this is my introductory remark, and I'll request you to take it forward with other experts. Thank you.
Thank you, sir. Thank you so much. Thank you for that interesting stage setting, I would say. You actually highlighted that the adverse effects of the pollution that we are seeing is not only on the feelings on the chest and in the breath, and but it actually adverse a lot of other important organs. We'll come back later to these and we'll discuss all this in detail, and you would be enlightening us. Now, I'd like to go further ahead to Professor Lalin Prasad. I was reading that Delhi, with an average AQI of 556, tops the list of the top 10 polluted cities all over the world by a Swiss-based organization, IQAIR. And in fact, three of the major metros in our country, that is Kolkata and Mumbai, are also among that list at different numbers, I think third and the fifth. So obviously we understand that pollution, that air pollution is not only a local phenomenon, it is not restricted to Delhi or India, it is a global problem. So Professor Lalin Prasad, would you please enlighten us what is the global scenario of the air pollution? Please unmute yourself. Professor Prasad, please unmute yourself.
Okay.
Yes, we can hear you now.
Thank you, Dr. Casey. Recently, there was a report from World Health Organization where it was stated that 7 million deaths per year occur because of the air pollution in the world. And the economic cost of this is tremendous. Every second, the world is spending around $9,000 every second because of the air pollution. And the problem is more severe in South Asian countries, including India. And you have rightly said that most of the cities in India, they are highly polluted. In fact, World Bank report states that out of 20 big cities in the world, 14 cities in India are which are brought into most polluted cities of the world. So this is a scenario in which we are living. Recently, we have all seen, for instance, when Parali is burnt in farms in Punjab and Haryana, what happened to Delhi. Virtually, Delhi has been locked down for some time. In the sense, business activities and all other activities, social activities, come to a standstill if you have fogs of this nature. And if you look some of the incidents which have happened because of air pollution in the world, these are very startling. For instance, I remember in 1952 in England, there was a fog which occurred because of the burning of the coal in the houses and factories and others. The result was the entire city was uh, overshadowed, overcovered by the fog of the nature, which was very dangerous for the health of the people, for the people who were not able to take breath properly. And what happened that when this fog started, a lot of vehicles which were stranded in the road, people started leaving vehicles and running towards home, and quite a few number of people died in fact in that, and also many of the people were drowned in Thames River. They just fell there and so on and so forth. And it was impossible for people to get out of their houses. The fog was so dense and so dangerous. A lot of chemicals have been mixed there, and as it normally happens, whenever, for instance, burning takes place of wood, or burning takes place of other fuel from petrol and diesel and other, and the type of toxic gases which come out in the open, they are a great health hazard for the whole world. In fact, there have been very interesting reports if you go through. Just I will give a brief account of a report which was Greenpeace South Asian Organization and Center for Research on Energy and Clean Air was published in 2018. And the direct cost which the world have to incur because of air pollution, it was stated that disability from chronic diseases which occur because of air pollution, around $200 billion per year world has to spend. From asthma, it is about $17 billion. From sick leave, which workers take, about $100 billion. Child deaths, $50 billion. And preterm childbirth, about $90 billion. So you can just imagine the tremendous cost which the entire world has to incur because of the air pollution. And there have been many incidents where a very large number of people were killed because of air pollution. In India, you know what had happened in Bhopal, where the several thousand people died because of the gases which emerged from the factory there. There have been many incidents in other parts of the world. For instance, in Iraq in 1991, when the army was defeated, the defeating army just burned the petrol areas where petrol was being produced. And the toxic gases which emerged in the air, a plane which was carrying 92 passengers from Senegal, that was caught into those gases, fog, and there was an accident and all the people died in there. So this is the type of um, these are some of the type of incidents where you can see the tremendous loss which the world has to incur. In 1986, we all know the Chernobyl incident which took place where a turbine was blasted in the nuclear plant, and this the radioactive which came out, it is spread, and more than 4,000 people died, and the large area adjoining Chernobyl were affected, and the diseases which came out of this, even the cancer was one of those diseases from which large number of people died. So this is the type of cost which world has to incur because of the air pollution. lot of incidents of this nature come up. Even now, for instance, when the burning takes place of the forest, United States only a few months back, you might have we have seen there was a tremendous loss of people, their houses, and the entire infrastructure of the area, and so on and so forth. So the whole world suffers from the uh, air pollution, and it's very sad that this type of scenario is there. Long back, our ancestors, our rishis and munis, they have called for 100 years of life. At the 100 years of life, Sarda Satam Jivama, Sarda Satam Pasrema, Sarda Satam Janayama. And that life is possible only when we have clean air to breathe. Because air is the most important element, or one of the most five important elements from which our body and our environment is built. That is called Chiti Jal Pava Gagan Samira Panch Tattvaya Rachit Sarira. These five elements, the earth, the water, the air, the fire, the sky. These five elements make our body, and they also make our environment. And if our environment is polluted, and particularly if the air is polluted, which is in our body, it is called pranavayu. If the air is there in the body is there. If that prana air goes out, the body goes out. And if we pollute that air, what would be the impact on the life that we can imagine?
Sure. Thank you so much. In fact, we had so many different aspects of pollution. We were just listening to from you, President Prasad. One is the historical perspective, which is actually very important. It is very sad to see that despite so much progress being made in technology, we still have to bear the burden of pollution, which actually was much severe decades back, but it is getting severe day by day, whereas somehow that technological advances are not coming to our benefit. Dr. Chabra sir, I would like to come to you with a question. These days we are talking a lot about primordial prevention, especially like in field of diabetes and metabolic diseases. We are trying to start right away at the time of conception. But I was just wondering what happens at the time of conception to the child in the womb. Does this pollution affect at that time also? Does it have any adverse effects to the baby who's yet to be born and who's yet to grow?
I'm thankful to you, Dr. JC, for this opportunity on this forum. Secondly, I'm thankful again for the nice introduction you gave in the beginning. Taking a point further, what Dr. Ani said.
Can you be a little bit louder, sir? Your voice is not very clear. A bit louder.
Taking a point to what Dr. Kilani said, that it's a gas chamber. What I call it as a life sentence for an unborn child. As soon as the child is born, we are giving a life sentence to the child. The day is not very far, unfortunately, where I may have to prescribe oxygen or a clean air to a child on a prescription. So you can imagine the scenario. What the question you asked is very pertinent. Yes, there is a definite impact on pregnant females and to an unborn child. It can lead to even miscarriages of stillbirth, which means death inside utero. Not only that, a child is born preterm, which means before 40 weeks of completion of pregnancy. The child may be having low birth weight as well. And later on, child is much more predisposed for asthma if a mother is exposed to dirty air. There have been neurodevelopmental impacts on a child development as well, resulting into autism later on in life. So, resulting from death to lung problem, to a CNS problem, you name it, and you blame it to air pollution to a pregnant female.
Thank you, sir. Thank you. That was very important. That unfortunately, the children who are exposed, not the children, the babies who are yet to be born, they have to bear the burden of our doing, and they have to bear it for their lifetime. This is a very, very disheartening fact. Dr. Khilani sir, I'd like to come back to you, and we are still I was about to say that we have just passed the era of COVID, but actually we are still living in the COVID era. So, sir, how does COVID and pollution interact? Is there something between them?
So thank you for asking me this question. What is COVID? COVID is a viral infection of the upper airways and the lung, and which, of course, with the systemic effects. So during the London fog that was mentioned when the air pollution came into highlight, there were 4,000 to 18,000 excess deaths, and these excess deaths were because of was attributed to air pollution. The people who were susceptible to these infections, namely elderly, those with lung disease, they died prematurely. So the pollution affects our airways in the form that it affects the mucosa, it affects the causes the inflammation, it reduces the immunity of the respiratory system and general system at large. So it is well known that people who are susceptible, people have lung diseases. During the time of pollution, there are more infections, and of course, we all know. Today in Delhi, people say, "मेरे को भी viral हो गया, मेरे को भी viral हो गया." Now, as the COVID came in 2020 March, and it came as a rude shock to the mankind, then the data started coming, and to our surprise, the initial data came from Italy, where the northern Italy, which is heavily polluted, had 4.5 times, that 18% mortality, as compared to southern Italy, which had 4.5% mortality. As we grew up in the pandemic, then report came from Harvard study, where it's a very large study actually published, which said that increase in 1 micron in PM 2.5 led to 8% higher mortality. And from Germany and Europe, another study came where the 85% of COVID deaths were in the area where NO2 was more than 100 ppm. Wherever the NO2 was less than 50, the mortality was exceedingly low. There was also a report from China. We don't believe much in Chinese studies, but the study is a study, is a properly conducted study, that COVID, the infection rate is higher if the pollution levels are high. Also, the transmission is higher if the pollution levels are high. There is also a theory that PM 2.5 helps in carrying the virus to the lower respiratory tract. So what I'm coming to is that is one, that whenever there is a COVID infection in a heavily polluted area, the severity of pneumonia is high, the mortality is high. It is proven beyond doubt. Now I'm coming to another part of it, that is post-COVID. We know that Zero survey has shown that 79% of Delhi people are already infected, whether diagnosed or undiagnosed. If you talk about India, about 67% seropositivity is there. If you talk about documentation, almost 3 crore 30,000 patients are there who have recovered from COVID, who were RT-PCR positive. So there's a large pool of people who are affected by COVID. How does pollution affects them? And I introduced in that there's the one young 37 years old, healthy, stout male. After COVID, when he is exposed to the pollution, he is unable to breathe. So what COVID does is, in 90% of patients with COVID, there is pneumonia. Whether you diagnose it by CT or whether you don't diagnose it, these people continue to have bronchial hyperreactivity. That is, their bronchial system is hyperreactive to any insult. And what can be more grievous insult than air pollution? The kind of air pollution we are facing with AQI of 400 plus all the time. So these patients, when in the post-COVID time, they feel more cough, they have more secondary infections, they feel more short of breath, they have wheezing. If you do their PFTs, there is airway obstruction. Also, these although these people keep taking antibiotics, because you go to a doctor, what will he do? He'll say you have cough, okay, you don't have fever, but you are bringing out phlegm. Okay, I'll give you azithromycin or coamoxiclav, moxifloxacin, so on and so forth. But I would like to highlight at this point of time that antibiotics do not help. They only respond to corticosteroids if necessary, inhaled corticosteroid or systemic steroids. So if I could summarize it, that in the area which are heavily polluted or polluted, there is higher severity of COVID if it occurs. There's higher infection rate and higher transmission. This is all documented. Also, in the post-COVID time, those who have had COVID, they have more propensity to respond to pollution in the form of increased cough, increased rate of infections, increased pneumonia, increased shortness of breath. I have had patients who were off oxygen in between after having discharged from the COVID times in April, May 2021. They have started requiring oxygen again in response to the bad air. So that is where we are. It only emphasizes the importance of if we could emphasize our policy makers to take action to control air pollution. Also, it is important from the patients who are susceptible to take preventive action to minimize the exposure. We'll talk about as you would order us. So I'll stop here. Otherwise, I'll keep talking. Thank you.
No, it's very interesting, sir. I'd just like you to elaborate one more sentence here. Because there are many people, as you very rightly said, who've suffered COVID and now who are having bronchial problems, cough, or breathlessness. What would be, even though you have mentioned about that in simpler terms, what would be your advice to them? Because if I understand properly, many people in whom the CT score was very little or not bad, even they also having breathlessness and severe problems. What would be your advice to them? What can they do themselves at home? What should they be doing अगर उनको ये सांस वगैरह फूलने लगे प्रॉब्लम हो?
नहीं, मैं ये कहूँगा डॉक्टर केसरी कि सांस फूलने की नौबत ना आने दें.
जी.
We should understand that we are living at times where the air quality is very bad. There are few things which I would like to advise. One, that during COVID times we said you wear a cloth mask. It is good enough because the COVID droplets are, the virus is thicker. It won't penetrate. I want to tell people that we were using masks for air pollution also. As far as the WHO, incidentally, I am member of the technically advisory group of Global Air Pollution of World Health Organization. By virtue of that, I am privy to the discussions which have gone there and the reports which come. So WHO has dumped as masks as a preventive measures for minimizing exposure of air pollution. But I discussed with them because they are talking about AQI of 25 and 50. We are talking about AQI of 400. They get worried if their PM 2.5 is 30. We are living in the PM 2.5 of 200, 250. So therefore, the mask has definite value, but the simple mask will not help. It will be N95 mask only if at all, if you have to go out. Other thing I would like to advise that during the time of smog, that is early in the morning, you don't see sun. People are used to going for their morning walks, and so that they live a better, healthy life. But I will strongly urge them not to go for morning walks, because that is the time when the pollutants are at the breathable level and the air pollution levels are high. Other thing, what happens that when you exercise, normally when we breathe, our upper airways are so efficient in filtering PM10 at least, that only 2% of the air pollutants would reach lower respiratory tract. But when you exercise, then your tidal volume increases. That means instead of 5 liters, you will breathe 15 liters or 20 liters. The filters gets obviated because you then start breathing through the mouth. Third thing is because of the deep breathing that you do during exercise, that pollutants reach much lower than the usual. They go into the lower respiratory tract. So these are the three things because of which I would advise that early morning exercise during this time should not be done. Those who have facility, those who are retired and can afford to go during daytime when the sunshine is good, that is the time that pollutants will go up. And that is the time they can go out for a walk, but always wear an N95 mask, which does cause claustrophobia, but nevertheless, you are causing more harm if you exercise in the time of bad air without a mask. That is one. Second thing is that air purifiers. Everybody has air purifier in their room. WHO has dumped air purifier completely. And my thinking is that for healthy people who do not have cardiorespiratory disease, air purifiers are of no value. They should not use it, and they should not think that my air purifier is showing AQI or PM 2.5 low, so I am breathing well. Those who have respiratory illnesses, asthma, bronchitis, or cardiac disease, they, to my mind, they should use air purifiers in this particular time, October, November, December, till the time the AQI is bad. But there are certain riders which I must say. One, that air purifier should be of good quality, which should have not only the filter, but absorbent also. Absorbent is the one which sucks the bad air like carbon monoxide and nitric oxide and sulfur dioxide. Filter will filter the particulate matter. That is one. Second is when you use air purifier in a room, the room has to be absolutely closed. If you keep opening the door or window thinking that you want some fresh air, then if the beneficial effect of air purifier goes away completely. Third is that the capacity of air purifier should be commensurate with the volume of the room. One should not think that you keep an air purifier in your table and think that your whole house is purified. No, that is not. Fourth thing is that maintenance of purifiers and filters is very important because they are notorious for getting fungus. So if you follow all this, then the people who have cardiorespiratory or some disease, then to my mind, they'll stand to benefit from that. Other thing is that if you suppose the person gets cough and tightness of chest or breathing difficulty and his oxygen saturation is going down, because the antibiotics are available over the counter, people keep popping up courses of antibiotic thinking that they have cough and expectoration. Then they will, please do not do that because it doesn't help. In my experience and the knowledge, the antibiotics have no value unless you have fever and pus like or yellow or green expectoration. They should always be taken under the advice from the doctor. So summarizing it, stay at home, do not venture out. If you are ill, if you have a pre-existing disease, you may use air purifiers. If you are going out for a walk, please use N95 mask, which is properly tied up. And those who are elderly, 65 above, must be vaccinated for pneumonia and flu prior to every year in August, September or March. Thank you.
थैंक यू सर, दैट वाज रियली वेरी इन्फॉर्मेटिव। मैं एक बार बस अपने श्रोताओं के लिए रिपीट कर दूं कि जैसे डॉक्टर खिलदानी ने अभी बताया कि वो नौबत ही नहीं आने दें कि आपकी सांस फूलने लगे। कुछ चीज़ें जैसे सुबह कोशिश करें कि बाहर ना निकलें जब धुंध होती है, सूरज की रोशनी नहीं होती, सुबह तभी निकलें जब सूरज की रोशनी तेज़ होती है, और मास्क ज़रूर पहन के रखें, N95 मास्क पहन के रखें। और एयर प्यूरिफायर जो है, जैसे डॉक्टर साहब ने बताया, बहुत ज़्यादा फायदेमंद नहीं होते। उन्हीं के लिए फायदेमंद होते हैं जिनको दिल की बीमारियां हो या सांस की बीमारियां हो, अस्थमा हो, ऐसी बीमारियां और सीवियर हो, और ये भी अच्छी क्वालिटी के होने चाहिए जिनमें एड्जॉर्बेंट्स भी हों। खाली एयर प्यूरिफायर बहुत महत्वपूर्ण नहीं होते। तो आपका बहुत बहुत धन्यवाद सर। दिस वाज रियली वेरी प्रैक्टिकल एंड वेरी इंटरेस्टिंग advice to all of our listeners. Professor Lalin Prasad ji, आपके पास आएंगे, and we would like to know what is the economic impact of this air pollution in our country and how is it adversely affecting our life? मेडिकल टॉपिक्स के बारे में तो हम सुन रहे हैं, आगे भी चर्चा करेंगे, बट इकोनॉमिक इम्पैक्ट क्या है?
हाँ डॉक्टर कृषि, आपने एक बड़ा अच्छा सवाल पूछा। जो रिपोर्टें पिछले कुछ दिनों में पब्लिश हुई थी, प्रतिवर्ष हमारे देश में लगभग 18% डेथ जो होती है वो एयर पोल्यूशन की वजह से होती है, और मोस्ट ऑफ द सिटीज इन इंडिया आर वेरी हाईली पोल्यूटेड। कहीं कहीं तो ऐसे रिपोर्टें हैं कि जैसे आउट ऑफ 10 पीपल 9 पीपल आर सफरिंग फ्रॉम एयर पोल्यूशन, और एक न एक तरह की कोई डिजीज उनको होती है। डॉक्टर खिलानी ने और डॉक्टर राजीव ने जो अभी बातें कही उसके बारे में, डॉक्टर खिलानी ने गैस चैम्बर के बारे में बात किया था। बॉम्बे में एक चेंबूर एरिया है जो बहुत बड़ी इंडस्ट्रियल एरिया बॉम्बे की है, और वहाँ एक कानू रिवर भी है। चेंबूर एरिया के लिए कहा जाता है कि इट्स वर्चुअली ए गैस चैम्बर। फैक्ट्रीज के जो टॉक्सिकेंट्स हैं और जो गैसेस वहाँ से निकलती हैं वो इन्वायरमेंट को इतनी ज़बरदस्त रूप से पोल्यूट करती हैं। मेरा ख्याल रहता है दुनिया के वर्स्ट प्लेसेस में उसकी गिनती इस समय होती है। तो इस तरह के बहुत सारे हमारे जो इंडस्ट्रियल सिटीज़ हैं, टाउन्स हैं, वहाँ अभी तक हमने एंटी पोल्यूशन डिवाइसेस को उस तरह से इंस्टॉल नहीं किया है जितनी उसकी आवश्यकता है। ये सिर्फ इंडस्ट्री हमारे अफेक्ट नहीं होते बल्कि हमारी पूरी इकानमी अफेक्ट होती है। और जो टोटल लॉस एक साल का 2019 में एस्टिमेट किया गया था वो 2,60,000 करोड़ रुपए का था, जो वायु प्रदूषण की वजह से इस देश को देखना पड़ा। एक तो सरकार का बजट बढ़ जाता है, जो हेल्थ एक्सपेंडिचर है, हेल्थ सर्विसेज के ऊपर गवर्नमेंट को जो अमाउंट स्पेंड करना पड़ता है वो हर साल बढ़ता जाता है, और उसका एक बहुत बड़ा कारण एयर पोल्यूशन रहा है। दूसरे जो डेथ होती हैं एयर पोल्यूशन से, उसकी वजह से जो इकोनॉमिक लॉस कंट्री को होता है, जो प्रोडक्टिविटी लॉस होता है, और जो काम के लोग चले जाते हैं। ऐसा अनुमान है कि ज़्यादातर डेथ्स 70 ईयर्स के अंदर ही जो रिपोर्टें बहुत सारी आई हैं। ऐसा नहीं कि खाली वृद्ध लोग इसी वजह से मरते हैं, कम एज के लोगों की भी काफ़ी डेथ होती है एयर पोल्यूशन से। और आजकल तो बहुत सारी बीमारियां इतनी कॉमन हो चुकी हैं, लंग्स डिजीजेज, जो छोटे छोटे बच्चों को भी और औरतों को भी हो जाती है, महिलाओं को, सबको। कुल मिलाकर अगर हम देखें तो जो बजटरी कास्ट हमारा है वो पूरे नेशन का और पूरे हाउस होल्ड का ये बढ़ता जाता है, और लोगों की लाइफ स्टाइल इससे अफेक्ट हो जाती है। और जो एक्सपेंडिचर और चीज़ों के लिए खर्च किया जाना चाहिए वो हमें हेल्थ के लिए हॉस्पिटलाइजेशन में खर्च हो जाता है, और बहुत से परिवार तो इसमें गुजर जाते हैं। और एयर पोल्यूशन इसका बहुत बड़ा कारण समझा जाता है इस देश में।
Thank you, Professor Prasad. Definitely, air pollution is it has a very significant adverse effect not only on our health, but obviously it has economic costs which we are all bearing together unknowingly. Professor Chabra sir, I'd like to come to you. I think in past decades we've been seeing and hearing more and more from families and friends कि अब बच्चा हमेशा खांसता रहता है, उसकी सांस फूलती रहती है. Like when I started practicing, nebulizers were not so common. They were, in fact, we had to go to specialized shops and buy. I remember when I bought my first nebulizer. It was not a common thing. But now I'm seeing literally every household has a nebulizer. So how would you like to comment on this?
I agree with you कि आजकल नेबुलाइजर प्रिस्क्रिप्शन जो है practically on every prescription. While my training was going on in UK and I used to visit India frequently, I was startled to see as to why and how frequently the doctors are prescribing nebulizer to every patient. I used to wonder why. And कहावत तो ये थी कि nebulizer जो है it should be driven by oxygen rather than by air. When I am here right now and seeing the patient and the problem of asthma rising rapidly, I have started prescribing myself. And as you rightly mentioned previously, it was not available at every pharmacy, but now every pharmacy keeps at least 10 varieties of nebulizer. So the situation is actually very frightening. लानी ने व्यस्त और वृद्धों के बारे में बताया कि भाई वो अफेक्ट हो रहे हैं. I can tell you the extreme end where I tend to see so many kids coming with asthma, and parents are quite frustrated with the quite of heat. If I tell you the number, 30% of pneumonias in children is attributed to dirty air. And not only that, 50% of cases of infant mortality can be indirectly attributed to air pollution. So these are quite frightening figures. मतलब एक एंड से अगर हम देख रहे हैं कि एडल्ट्स अफेक्ट हो रहे हैं, on same end we are seeing kids getting affected, and it's quite painful from a parent's perspective and from a pediatrician's perspective to see these kids suffering and requiring medication and nebulizer every now and then. And we are not able to answer to the parents as to what is going to happen in their future.
थैंक यू सर. सर एक बात पूछना चाहता हूँ यहाँ पे, जस्ट अ कनेक्टेड कमेंट आई वुड रिक्वेस्ट कि यूजुअली वी वुड से अगर कोई अस्थमा का बच्चा आता है जिसको 5-7 साल का अस्थमा होता है, सो आई थिंक आई हैव हर्ड पीडियाट्रिशियन से कि आप चिंता मत करो, 10-12 साल तक की उम्र में ही विल आउटग्रो इट, और वो जो है उसको बाद में नेबुलाइजर या उसको इनहेलर की जरूरत नहीं पड़ेगी. So does that still hold true, or because of the rising air pollution you feel that the asthma and the bronchial reactivity it becomes more severe and gets more prolonged and into the adult age also? आप क्या बोलते हैं सर?
You very rightly pointed out that by the age of 12 years, most of the kids tend to go into remission. We can attribute it to hormonal changes which are happening. The pollutants haven't disappeared as such, but it's just that the bronchial hyperreactivity which was there has gone down. So suddenly जो जितने भी pollutants थे वो disappear नहीं हो गए हैं, वो वहीं पे हैं. It's just that I have started reacting less to all those pollutants, thereby resulting into less of nebulizer usage post age of 12 years. हम ये बोलते हैं पेरेंट्स को कि चाइल्डहुड एस्मा has still a slightly better prognosis as compared to adolescent or adult onset asthma. 18 साल तक अगर ठीक हो गया, well and good. नहीं होता है तो unfortunately they will continue to have all these episodes every now and then.
थैंक यू सर, थैंक यू. डॉक्टर खिलानी सर, अभी हम सांस की बीमारियों के बारे में हमने बहुत बात की, बट आई थिंक और आपने कार्डियो रेस्पिरेटरी डिजीज के बारे में भी बात की, बट आई थिंक द इम्पोर्टेंस इज स्टिल लॉस्ट टू द लार्जर ऑडियंस की पोल्यूशन से खाली सांस की बीमारियां ही नहीं होती, खाली अस्थमा ही नहीं होता, खाली सांस ही नहीं फूलती, कि पोल्यूशन की वजह से दिल का दौरा भी बढ़ सकता है, स्ट्रोक भी हो सकता है और डायबिटीज भी हो सकती है. सर इसके बारे में कुछ बताएंगे?
नहीं, देखिए ऐसा है कि सब लोग कहते हैं PM10. when the first study was conducted under leadership of Dr. Pandey, which I was a part, it was that time PM10 used to be measured. PM2.5 अभी दिल्ली में measure नहीं हो रहा था, because at that time it was thought that जो particles which are less than more than PM10 micron do not go into the lower respiratory tract, and then came PM2.5. These are the particles which actually go to the lower respiratory tract and cause more harm than PM10. But we do not talk about ultrafine particulate matter. Ultrafine particulate matter is the particles which are measuring 0.1 micron and lower. These are the particles which go into the lower respiratory tract and also penetrate from the airways to the blood and go into the blood and then go into everywhere: kidney, brain, heart, blood vessels. So these are the particles which cause damage to the heart, damage to the brain, damage to the intestine, damage to the kidney, damage to the every tract, every system of the body. So there is the study which I am referring to, which was Dr. Pandey's study, which actually brought CNG and everything into Delhi. In that study, there was increase in emergency visits to heart attacks by a fraction of 24.3% in response to increased air pollution in last 48 hours. This was the
48 hours.
48 hours, yeah. And this was the time series analysis which was conducted on 1 year study. I was actually conducting it along with my colleagues under guidance of Dr. Pandey. We collected all the emergency visits of asthma, bronchitis, and heart attacks. So asthma and heart attacks were increased by 24% and COPD by 21%. So why I'm telling you all this, answering your question, that air pollution, after all, what is particulate matter? Particulate matter is not one. Particulate matter caused by diesel is different. Particulate matter caused by petrol is different. Particulate matter caused by dust is different. Particulate matter caused by household air pollution is different. So the impact is also different. For example, if you talk about cancers, then there are polyaromatic hydrocarbons, which are emitted mainly by diesel and also by kerosene. Kerosene and diesel have similar emissions. So they not only affect lung, there is nothing more proven than lung cancer caused by diesel emission. From the similar analogy, these polyaromatic hydrocarbons, they penetrate the system and they go into the blood and they reach everywhere. So, and of course, carbon monoxide. Carbon monoxide is a big culprit. And if you go through the WHO air quality standards, you will be shocked to know where we are and where the WHO is asking. Carbon monoxide has immediate effect on heart attacks. So therefore, I can go on with giving scientific studies and the logic, but suffice is to understand that these ultrafine particulate matter, 0.1 micron, they penetrate the lung airways and go into the blood, and all the damaging chemicals reach everywhere. So it is proven that heart attacks are more. The diabetes, I'm not sure. I don't think there are a lot of data that but complications of diabetes will be much more if you are exposed to air pollution. Gastric cancers are much more. So therefore, almost every disease will be adversely affected by air pollution. And again, at the cost of repetition, I am saying that pollution is not one. Pollution is adulteration. Now, adulteration with diesel will be different, adulteration with parali will be different, adulteration with dust will be different, and their impact will also be different. So therefore, almost every system of the body, and we are sure that strokes are more common, hypertension is more common, we know about it, the heart diseases are more common, and that all leads to what we call as reduced life expectancy by 8 years. It's not a small thing. That has been estimated that, and it is causing, as per the 2015 data, it causes 10 lakh extra deaths because of outdoor air pollution, 10 lakh extra deaths due to indoor air pollution only in India. Other thing I want to tell you, which is not your question, only 1 in 10 person in this world is breathing fresh air. So it's not only India that is affected. As far as the WHO standards, this is a WHO report, not mine. Only 10% people are breathing healthy air. So the impact of air pollution, if you talk about the data, US data, Boston 20 city study, is long term is very, very bad. Thank you.
Sir, in continuation to this, one question that is the pollution different, the outdoor pollution and the indoor pollution?
So indoor pollution is more dangerous than outdoor air pollution. This is because uh, where does the indoor air pollution come from and where does it occur? Very small percentage of people are, a large proportion of Indian population is still using domestic fuel. And domestic fuel can be a wood, can be a charcoal, can be a paper, Anything they get which can be burned, they use it. Especially in winters, there is no ventilation in the room, in the kitchen. Not only the house lady is affected, that people who eat food, and it's a tradition in India that the lady or the homemaker is cooking, making rotis, and people sit around the kitchen and eat. And if there is a winter season, they close the windows because it's too cold. And the studies have found that whenever there's a cooking going on in the room and the window is closed, the PM 2.5 level reaches 30,000. It is unbelievable, but it's true.
30,000.
30,000. It is unbelievable, but it is true. So that is why the Indian ladies who are more often non-smoker as compared to there is a large proportion of ladies are having, especially in the rural, having COPD, which is the second leading cause of death. And 17% of lung cancers in India is because of non-smokers. And these non-smoking people getting lung cancer is mainly because of air pollution. So the question that you asked, the indoor air pollution is more detrimental because there is no ventilation at homes. Thank you.
Thank you, sir. Thank you. Those are very enlightening facts. Professor Lalin Prasad, I'd like to come to you, and I would like to understand what could be the social impact of air pollution. Does it have an adverse social effect on the society as well?
A very good question. In fact, the entire life pattern is affected by air pollution. Now, for instance, take traveling. Because of air pollution, the number of people traveling has been considerably reduced. And then there are a lot of restrictions also at certain places where one can't go because of the climatic conditions and because of the air pollution and so on. So most people have to be confined to homes or to their cities or to their towns. Traveling has become a problem for most of the people. Then you take entertainment, for instance. Now, the only entertainment which remains with the people is confined to the facilities which are at home. They can have their television on, or they can have mobiles on, and so on and so forth. One thing that you will find that invariably, which is happening in all households in India and even in other countries, that mobile has become so popular, and people are virtually confined with mobile in their homes. Unless there is it's very necessary for them to go out for shopping, and that shopping also is being affected terribly because of this. Most people don't want to go for shopping. Also, they would like to order from internet and get the goods at home and so forth. Movement of people has been affected. Less and less movement of people. It is going to be a problem for not only on their health but also psychological problems which are being created because of this. And you find that most of the people, I mean, the social interaction, overall social interaction has been considerably reduced these days because of the air pollution. And this is going to happen in future also in a very big way. Then the consumption pattern also is going to be affected. Now, a lot of food people will order from home itself instead of going out in the restaurant, going out in open places for food and things of this nature, because the areas may be polluted and because there may be some other restrictions. But uh, family functions are being reduced. Lot of marriages which used to take place, they don't take place with that rhythm or with that type of charm which you find Indian marriages, and people mixing so freely and dancing and uh, entertaining and things of this nature, and also performing worship and things of this nature. All these things are affected by the air pollution. So we can say that entire life as such is getting affected the entire social behavior pattern is being affected. There is a psychological impact on the people also. And what WHO has rightly said, that air pollution is the biggest threat to the humanity at present.
Thank you. That very rightly said that air pollution at this point of time is actually a big threat, not only physically but emotionally, and as you've very rightly enumerated. Look, Chabra sir, I'd like to.
Yeah,
Yes,
I would
yes,
like
yes,
to
sir.
add on few more things.
Yes, sir.
We pediatricians are always bothered about children, as you can imagine. Schools have been shut. It has a tremendous impact overall their development. Childhood comes once only, and they are not allowed to play outdoors. Their childhood is getting wasted like anything. The development is hampered, resulting into less of cognitive outcome. A lot of motor development is happening. A child is sitting mostly indoors playing all these video games and playstations, and leading to inactivity, which is further leading to obesity. Obesity is the next curve. So it has a lot of social impact as far as health is concerned.
It's right.
Very true, sir. Very true. In fact, this is what I wanted to ask you. So, have you felt that the childhood obesity is being adversely impacted by this? First, we had this almost 1.5 to 2 years of COVID. Children were not going out. Now, when the school opened, again the schools have been closed. So again they're limited to home. As you very rightly said, this increase in the screen time, in the mobile time, and no going outdoors, do you feel that it is going to increase the childhood obesity and the subsequent oncoming metabolic syndrome and such disease?
I call obesity as mother of all illnesses. If a person is obese, you invite all other troubles resulting into hypertension, stroke, resulting into heart problems, and you name it and you blame it. Diabetes and its own hazards comes with obesity, and what we call as Parker hypothesis. The obesity, the fat cells increase in number during childhood, and they only increase in size later on during adulthood. Therefore, the number of fat cells, if they are increased in number during childhood, that can result into obesity later on. So you must have seen so many adults eating 1 or 2 chapatis and they are gaining weight. On the contrary, they may be eating 5, 6 chapatis and they are still lean and thin. It's all been blamed to childhood obesity. Therefore, yes, it's an indirect curse on the mankind. This air pollution is leading to.
Thank you, sir. So, regarding this, do you advise routine vaccination for children as well uh,
Yes,
for
for prevention of pneumonia, influenza,
yes,
yes, we all want to protect with whatever ways and means we have. And immunization is one of the ways in protecting us against few illnesses, what we call as vaccine preventable diseases. Influenza is definitely one of them. And the influenza season in North India starts from September till March. So if whoever has to take, the best period is September, October, because influenza virus propagates during winter, but needs a bit of moisture as well for replication. So coming to the point that not only COVID we are worried of, but all other respiratory viral illnesses, they also flourish with air pollution. So we need to prevent as much as we can.
okay. Thank you, sir. Thank you so much. Dr. Shilani, sir, I would like to come to you,
Yes,
and I would like to, sir, I would like to ask because we've been seeing that this very high PM, this very high AQI is usually during these 2 3 months. So does it so happen that we are exposed to these high levels of pollutants for these few months maybe, and does that have an adverse impact throughout the life for the rest of the period? or is it only transient for the
No,
period of
it is
exposure?
not transient at all. It is not transient at all. And it is, if you, of course, as a senior physician, you know what COPD is a very irreversible disease, and there is a progressive decline in lung function. Whatever you may do, unless you remove the insult, then also the lung function do not improve. They can plateau at best. If the person quits smoking, the decline will slow down. Now, previously it was not believed several years back, but now we know that air pollution is one of the most important, after the tobacco smoking, is cause of COPD, which is the second major killer. Now, to scare you a little more, that air pollution, as per the WHO report, is fifth killer, fifth commonest killer cause of mortality. So how does this mortality occur? It is not because of the viral infection, not because of blockade of the nose, or not because of the chest tightness that we are feeling. It is because that air pollution causes not only lung cancer and COPD and pneumonias, it causes coronary artery disease, it causes heart attacks, it causes brain attacks or stroke, it causes cerebrovascular disease, and it causes cancers of every system. Now, for 20 years, the statement which I keep reciting is that air pollution affects our body in many more ways than we know. Because to prove a fact, it has taken so many years for us to prove that air pollution causes COPD. 20 years back, nobody thought that diesel emission is directly related to cancer, because to generate data is not easy. And it had to be, London fog had to come for people to realize that there were excess deaths. But air pollution is, even before Christ, it was there. Air pollution has been there all the time. So therefore, the Boston 20 city studies, which is actually landmark study, which is not a retrospective study. It's an ongoing study which went on for several decades, which also proved that exposure to air pollution leads to not only the higher morbidity but mortality also. So therefore, if we are breathing bad air, whether because of parali or whether because of diesel emission or the petrol emission or because of household air pollution, it affects our cardiovascular system also, besides lungs, pulmonary system, and also the brain. And now, to come to think of it, you are a diabetologist, I know. So the complications of diabetes, which are well known to all of us, will be much more if you are exposed to air pollution. Therefore, it will add to not only the complications and the mortality also. So simplistic thing that if you talk about coronary heart disease, it will be more common if the person has diabetes and is exposed to the air pollution. So overall, it's not a joke that our life expectancy is cut down by 8 years. 8 years is a pretty long time. And as Dr. Saab said, Vayu and 100 years, that in जो मनुष्य का जीवन जो किया था ये आश्रम, संन्यास आश्रम तक जाके 100 साल तक, उसमें हैम्पर है इस वजह से. और ये ऐसा नहीं है कि it's a preventable tragedy actually. So we can talk about it, what we can do about it. I don't know whether it's a subject to be discussed, but I am very vehement about ways to control pollution, because we are following United States, because California had almost similar pollution 80 years back, and 80 years down the line, their number of cars have gone up 10 times, the pollution has gone down 10 times. It is because of the corrective measures that they have taken in terms of fuel quality and engine quality and control of the industries. Today in UK, if you buy an electric car, you don't pay any taxes. So it's a government's commitment towards improving the air quality. Thank you.
Thank you, sir. Thank you. We'll come back to what you just mentioned. I think that is one of the very important questions that I'm going to ask, and I'm going to ask each one of our panelists that what actually can we do, or can we do something in. And also, Prasad, I would like to come to you, and because we are talking of life and economy, so how does that affect the Indian industries and businesses? Is there any correlation between pollution and decreased output somehow?
Good question. There is a direct relationship between productivity and the pollution. The more the pollution, less the productivity. And particularly when we talk of air pollution, the absenteeism in factories and in companies and in offices is considerably increased. In fact, there are many interesting studies over this. It has been found in one of the researches that 1.3 billion days are lost because of air pollution in the Indian companies and factories and Indian businesses and establishments. Now it's a big loss. There are many things which we can discuss about how the Indian business is affected, but some of these I will try to highlight. Number one is that there is a lot of closure of business. During period of COVID, for instance, there was complete lockdown and the entire business was stopped. The factories were closed and so on and so forth. But even in normal times, when the air pollution is beyond limit, you find that offices and factories and workplaces have to be closed. And this happens in most of the cities in India. And recently, we have seen in case of Delhi, for instance, and this Noida and other places where a lot of closures took place because of this. Schools were closed and factories were closed and establishments were closed. So business loses about this. Then we find that supply chain to business is disturbed because transportation becomes difficult. Trains get late, trucks get stranded, and the entire supply chain, if you look into the total cost of this, goes to be very high. Goods don't reach the raw materials don't reach factories in time. People don't reach offices in time. So the transport is affected, and this affects the productivity as a whole. We also find that energy cost of the companies goes up because of restrictions, which is now, for instance, burning of coal is getting restricted now. Burning of petrol and other things are getting restricted gradually, and the cost of production, cost of energy is tremendously going up. So when you have the pollution, you also find that the energy cost of the companies goes up. Then packaging cost goes up. You have a lot of restrictions which government has imposed, and particularly this is affected by the climatic conditions, air pollution and things of this nature. So business has to incur additional costs to run its business. And one of the biggest losses is, which have been pointed out in many studies recently, is that the consumer footfall has decreased considerably in the malls, in the shops, in the places, shopping places, and things of this nature. Less and less people are going out for shopping, and this reduces the sale, or this goes into reduction of the total sales of the business, and the losses which have been computed are very high in this regard. Most of the businesses suffer because of this. So if you look over overall scenario, um, air pollution and other forms of pollution are a big jolt to the business, and business is seriously affected because of this.
Thank you. Thank you. That was very insightful. That Actually, I think it becomes a double-edged sword, as Professor Prasad was pointing out, that fewer people are going out and fewer people are visiting shops and malls and markets. At the same time, it may be because of the restrictions, and those restrictions are for the benefit of those individuals. So I think it is important to calculate and balance the economic costs against the health costs and the cost of treatment of the diseases. I would like to ask one question to both our esteemed panelists, because I think this is one thing. There's this misconception, or there's a perception among our population that pranayam is very good and helpful, and for any lung diseases, it is the Ramband and should be done. So during this situation, especially, sir, I'll start with Dr. Khilani, sir. What would you recommend regarding these exercises? These are after all breathing exercises.
So I don't know whether you call it a misconception. We know that pranayam is a yogic kriya,
Yes.
time honored, and there are studies done at All India Institute of Medical
No,
Sciences.
I meant misconception, because during this time of air pollution, if you
Yeah,
go to the park at 5 a.m., do the pranayam, I'm talking about that, not the.
yeah. And no, I'm telling you what the studies was done as the PhD thesis at All India Institute of Medical Sciences. The asthma improves if
Yes.
you are doing pranayam and yoga. And other thing is that whether it's not a Rambam. I agree that it's not a solution to everything. It's a way of life. It is something which leads to better. If I talk about COVID, I'll come to the point. In the post-COVID patient where the pulmonary fibrosis and the bronchial hyperreactivity and the respiratory symptoms are common, I at least generally recommend them that instead of, you can do a breathing exercise with incentive spirometers and machine. If you do a pranayam, that is actually a breathing exercise with some kind of spiritual or focusing this thing. So during bad air quality, it is a harmful thing to do a pranayam during smog in an open garden, as like any other exercise. But I don't think it's my personal opinion that one should stop doing pranayam in your own house. So that's the bottom line of it. That big no for doing this breathing exercise, any kind of breathing exercise, including pranayam, in an open garden during the smog time in the early morning. But if you are used to doing pranayam yoga in your own room, that's perfectly all right. Whether it will protect you from adverse effects of air pollution, I'm not sure. There's no scientific data on that, but it will cause no harm, that I'm sure about. Thank you.
Thank you. And Dr. Chabra, sir, what is your opinion? Do you recommend your children, especially those with asthma, how to do it and to do or not? So I think you are muted. We can't hear you. Or it's got disconnected.
No, he's connected.
As an adult,
Yes, yes, yes.
have to lead by example, which means we have to teach our kids as to how to do what's the correct technique of pranayama. So I agree with you that this season is not the best of all seasons for doing this pranayama, but you need to inculcate this habit into the kids, so that rest of the 6 months or 8 months when the pollution is less, at least lungs are staying healthy. So if they keep doing the same exercise 8 months, these 4 months is the time when they can reap the benefit. So and the timing, as you mentioned, is has to be right. So yes, 12 noon to 5 p.m. is a better time for doing any of these exercises when the air pollution is at its lowest level, and take benefit of the rest of the season of the year where they can keep doing all these exercises. So exercise during these 4 months will not make your lungs healthy and strong forever. So it has to be a habit, continuous habit of keep doing the same throughout the year.
I think that is very inspiring and a wonderful suggestion, that we have to make a habit of doing these exercises. Not only be physically active, do general aerobic exercises, as we diabetologists and physicians suggest, but also make a habit of doing breathing exercises because they are also going to be very helpful to us in the coming periods and years. One more question to both the doctor panelists, because most of our listeners are interested in food. That is just like in diabetes, when the patient comes to us, the patient wants to know कि डॉक्टर साहब मैं क्या खा सकता हूँ. So people want to know that is there any particular foods which might be beneficial, which they should focus on. ऐसी कुछ खाने की चीजें बता सकते हैं, ऐसा कुछ होता है क्या जो इस समय में beneficial हो?
If you're asking me, not to my mind, only healthy food, balanced diet will go a long way in protecting yourself from any kind of insults to the body, be it pollution or the infection. I am not aware of any diet which will specifically protect you from air pollution. Thank you.
Yes, thank you, sir. Dr. Chabra, sir, would you like to comment also? Dr. Chabra, sir, can you hear us?
Healthy throughout the year, not stressing upon during these 4 months. What we stress upon in kids to prevent from infections is, and the data is coming from West as well, as to honey 1 teaspoonful daily prevent against respiratory tract infections in the child. That is to be given after the age of 1 year. So honey 1 teaspoonful daily is beneficial for respiratory infections. Loads of vitamin C in form of oranges, amla, nimbu pani, whatever they want to give. I would always prefer natural food for replenishing vitamin C levels, and have a bit of antioxidants, which can be in form of berries, something like broccoli, and omega fatty acid if they are non-vegetarian in terms of fishes. So antioxidant definitely play a role in having this prevention from oxidative damage.
This
So
is
these
what I wanted to. Yes, sir. Yes, thank you, sir. Yes, yes. Yes, please continue, sir. Sorry, I interrupted. Please
I'm
continue.
done. I'm done. So
Thank you,
vitamin
sir.
C, honey.
This is what I wanted to bring up, Dr. Khilnani, sir. कि antioxidants are plenty of them are available in form of vitamin E, and other also are more potent are available. So, do you suggest any such daily antioxidant supplementation?
See, the thing is, these are all what Dr. Chabra said are may not be restricted to these 4 months. I'm using his narrative. It may not be used for 4 months. During COVID time, people were taking zinc-based vitamins for ages. It went into so this is the part of healthy lifestyle. Fresh fruits, vegetables. Fruits means oranges, lime. Vitamin C. Amla is very good. Honey is traditionally said to be good, but yes, if you want to ask me as a pulmonologist, I would say that this time it is important to avoid chilly drinks, chilled drinks. ठंडी चीजें बिल्कुल avoid करनी चाहिए. Anything which affects your throat like achar and all those things which hurt your stomach, because I believe there is a relationship of gastroesophageal reflux with the respiratory symptoms which is very strong to my mind. So when I said the healthy food, that's what I mean. That fresh fruits, fresh vegetables. I don't subscribe to taking medications at this time. I mean that's my personal view. That otherwise, if I advise and people start taking, there was a time when in US average person was taking 7 type of pills. Healthy person, vitamin C भी ले लो, antioxidant भी ले लो, ये vitamin भी ले लो. There is no scientific evidence that it actually protects. So healthy, if you take good amount of vegetables, which means 5 times a day you take good healthy meal, which can be that's good enough. It will provide you antioxidants, it will provide you vitamins, and the rest of the things are is a part of the good health. But that's my personal opinion.
Yes, thank you, sir. I think, and I completely agree with you, and this is what I also prescribe, that a good healthy diet is more important than anything else, any of the
Otherwise,
supplements.
people keep popping. There are some people are fond of taking medication. Then COVID times, I saw people, vitamin D3, calcium, and whatnot.
And Kada
That
also.
helps. Kada also.
Yes.
Also. Yeah, actually, with Kada, people got so much gastritis, they started vomiting and so on. And one of the thinking was it's off the track, but too much of steam inhalation was implicated in mucormycosis because you actually damaged your mucosa by taking too much steam. Thank you.
Just one thing unrelated, but I would like to mention here because maybe the audience would get benefited because we see so many patients with dengue having this uh, bakri ka doodh, and that causes severe gastroenteritis. So people land up with emergencies not because of dengue, but because of the gastroenteritis, which is caused by this milk that they're having. So anyway, continuing our topic, I'd like to ask Professor Lanpsaji, we obviously know that whatever is being done by the government, by the agencies, and by ourselves also is not enough. So, what is your opinion? What is the way out? अब है तो प्रदूषण है, क्या कर सकते हैं इंडिविजुअल लेवल पे और पॉलिसी लेवल पे?
इंडिविजुअल लेवल पर भी और पॉलिसी लेवल पर भी बहुत कुछ है जो अभी किया जा सकता है, बहुत कुछ किया भी गया है, जैसे वृक्षारोपण है या जंगलों की एरिया बढ़ाने वाली बात है। अगर इस पर ज़्यादा ध्यान दिया जाए तो जो ऑक्सीजन का उत्सर्जन पेड़ों से होता है, पौधों से होता है, ये जो क्राइसिस है एयर पोल्यूशन की, इससे काफ़ी हद तक निजात पा सकते हैं। रिन्यूएबल एनर्जी को बढ़ावा देने की आवश्यकता है। पेट्रोल और डीजल इनको जैसे भी हो धीरे धीरे फेज आउट करना पड़ेगा। जैसे सीएनजी लाई गई तो उससे कुछ फ़र्क पड़ गया, या जो रिक्शा बैटरीज वगैरह अब चलने लगी, इनसे फ़र्क पड़ गया। तो इस तरह की जो एनर्जी का जो सिनेरियो है, इसको चेंज करना पड़ेगा। It will be a little costly in the, but this is going to be one of the measures which I suppose is going to be very effective. और जैसा पहले भी हमारे स्टीम स्पीकर्स ने कहा था कि कारों की संख्या बहुत बढ़ती गई है, और जैसे पहले अमेरिका में हुआ था वैसे अब तो इंडिया में भी हो गया है। और दिल्ली शहर में ही इतनी कारें हैं जो मेरे ख्याल कलकत्ता, बॉम्बे और बेंगलुरु को मिलाकर है। तो इस तरह की प्राइवेट कारों की संख्या बढ़ाने से तो पोल्यूशन और बढ़ता ही जाएगा। अगर सार्वजनिक ट्रांसपोर्ट को बढ़ावा दिया जाए, जैसे मेट्रो का है और बसों का भी है, इस तरह से लोग ज़्यादा उपयोग करें, या हफ्ते में 2 दिन 3 दिन गाड़ियाँ इस्तेमाल करें, 2 दिन 3 दिन कुछ और इस्तेमाल करें, तो ये फेजिंग आउट ऑफ व्हीकल्स कुछ हद तक इस स्थिति को संभालने में बहुत मदद होगा। बाकी जो भी कहा गया कि लकड़ी का चूल्हा घरों में अभी भी जलाया जाता है, ये सच है। गाँव में और रिमोट एरियाज में अभी भी बहुत है, लेकिन इस पर काफ़ी हद तक अब कंट्रोल हुआ है, क्योंकि जो घरों में गैस देने लगी है गवर्नमेंट, और देहातों तक ये पहुंच रहा है धीरे धीरे। तो ये मेजर्स अच्छे हैं, सक्सेसफुल हैं। बाकी इकोनॉमिक्स में एक मेजर प्रिंसिपल है व्हाट वी कॉल की पोल्यूटेड पे प्रिंसिपल, कि जो पोल्यूशन करता है वो पे करेगा। और इसके लिए देखिए फैक्ट्रीज पर जो गवर्नमेंट ने जो नियम बनाए हैं कि एंटी पोल्यूशन डिवाइसेस इंस्टॉल किए जाएं, और जो चीज़ें पोल्यूट करती है उनको धीरे धीरे फेज आउट किया जाए, तो इस पर बहुत सख्ती से काम होने की आवश्यकता है। क्योंकि जो सोशल रिस्पॉन्सिबिलिटीज़ कंपनीज की हैं और जिसके लिए उनको गवर्नमेंट फैसिलिटीज़ भी देती है, तो उस हद तक कंपनीज एक्सपेंडिचर इन चीज़ों पर नहीं करती, एक्सपेंसिव चीज़ों के लिए नहीं करती जिनसे वातावरण को इतना लाभ हो। और मैं समझता हूँ कि वायु प्रदूषण एक ऐसी चीज़ है कि कंपनीज और इंडस्ट्रियल इस्टेब्लिशमेंट, बिजनेस इस्टेब्लिशमेंट सारी इससे अफेक्ट हो रही हैं। तो ये उनकी जिम्मेदारी भी होती है कि इस तरह के एंटी पोल्यूटेंट डिवाइसेस को इंस्टॉल करें और ऐसे स्टेप्स लें कि पोल्यूशन कम से कम हो और सोसाइटी को कम से कम लॉस हो। मेरे ख्याल ये सब कुछ इस तरह की एफर्ट्स हैं। अगर इनको थोड़ा और बढ़ावा दिया जाए और इंसेंटिव दिया जाए, और लोगों के अंदर साफ सफाई रखने की जो प्रवृत्ति जो हमारे मोदी जी ने भी सफाई अभियान वगैरह चलाया है, तो इस तरह की चीज़ों से पोल्यूशन पर कुछ हद तक तो कंट्रोल पाया जा सकता है।
थैंक यू, बहुत बहुत धन्यवाद। और ये बिल्कुल सही और बहुत ही सही डायरेक्शन में बात कही है। डॉक्टर खिलानी सर, आपके पास आएंगे। व्हाट डू यू फील इज द वे फॉरवर्ड? क्या हो सकता है, क्या कर सकते हैं?
नहीं, किसी भी चीज को ठीक करने के लिए उसके कारण का पता करना होता है। तो कारण में जाएं तो द मेजर सोर्स ऑफ एयर पॉल्यूशन रिमेन्स व्हीकल्स। The second major, as on today in Delhi and nearby area, remains the stubble burning, and then of course the dust and the unorganized constructions और सारे बहुत सारे जो है ना आउटडोर एयर पॉल्यूशन की बात करें, इंडोर की बात नहीं कर रहे। तो ये तो डूएबल है। जैसे मैंने एग्जांपल दिया था कैलिफोर्निया का, द इंजन क्वालिटी एंड द फ्यूल क्वालिटी बोथ आर इम्प्रूव। implementation of the rules or law, that is important। मतलब मुझे व्यक्तिगत ज्ञान है कि अगर जर्मनी में आपकी कार is found unfit once, you have to dump it in the dump yard, you cannot use it। तो अगर आपके व्हीकल्स की संख्या अमेरिका में कम नहीं है, इंग्लैंड में भी कम नहीं है, इंडिया में भी कम नहीं है, लेकिन वहां पर क्यों इतनी एयर पॉल्यूशन है? क्योंकि वहां की इंजन क्वालिटी और फ्यूल क्वालिटी रेगुलेटेड है। आप ये कहना बहुत आसान है कि मैं 4 किलोमीटर दूर हॉस्पिटल आता हूँ, तो मैं सबको कहूँ कि आप हफ्ते में 2 दिन कार में ना आए और एक ऑटो रिक्शा में या किसी पब्लिक ट्रांसपोर्ट में आए। पब्लिक ट्रांसपोर्ट हमारे यहाँ अच्छा है, मेट्रो बहुत अच्छी है, लेकिन सब लोगों के इस्तेमाल नहीं कर सकते। हमने ऑड इवन करके भी देख लिया, उससे भी एयर पॉल्यूशन कम नहीं हुआ। तो जो मैं कहना चाहता हूँ कि जो रूल्स हैं, रेगुलेशंस हैं इंजन के बारे में, फ्यूल के बारे में, उनको एक तो बहुत रेगुलेट। स्टबल बर्निंग ऑफ कोर्स इज अ बिग इशू। थर्ड इज द इंडस्ट्रीज, स्मॉल स्केल इंडस्ट्री। जो ये सीएनजी जब आया था तब सारी इंडस्ट्रीज 50 किलोमीटर दूर कर दी थी सुप्रीम कोर्ट, ऑनरेबल सुप्रीम कोर्ट के ऑर्डर से। तो देयर आर सो मेनी अनऑर्गेनाइज्ड स्मॉल स्केल कहना चाहिए, कुछ हाउस होल्ड इंडस्ट्रीज आर गोइंग ऑन, वर्कशॉप्स हैं वगैरह वगैरह बहुत सारी जो है ना। तो सोर्स पे हमें जो है ना फोकस करना पड़ेगा, एंड इट इज फॉर द पॉलिसी मेकर्स टू कम अप टू दैट ओकेजन। एंड एक बार मैं इंग्लैंड के किसी एक्सपर्ट्स की बात सुन रहा था, तो उन्होंने कहा, उसने बोला, मैं नहीं बोल रहा, कि पॉलिटिशियन डोंट सी बियॉन्ड 3 years or 5 years। तो somebody has to think beyond that, कि 2030 में क्या होगा, 2050 में क्या होगा, तभी हम इसका समाधान कर पाएंगे। नमस्कार, थैंक यू।
I think that was a very wonderful and actual comment, that we have to think of the long-term perspectives and the implication. Dr. Chabra sir, आप क्या कहना चाहेंगे? How do you see the future?
So yes, I would like to take it a point further कि willfulness होनी चाहिए, determination होना चाहिए to do something better, and that we can do it. It's not that we have lost this battle against air pollution. I can only summarize whatever has been discussed for the benefit of our listeners. कि एक तो जैसे हमने डिस्कस किया है कि सुबह 6 से 8 जब अभी सूर्योदय नहीं हुआ है, that time is supposed to be the worst time. Therefore, जो भी आउटडोर एक्टिविटी करनी है, प्लान इट ड्यूरिंग 12 to 5 if at all. जैसे अब मैं हमेशा बच्चों के ही समर्थन की बात बोलूंगा, so outdoor plays have to be there for their better growth and development, so manage their outdoor play time as well. जैसा डॉक्टर खिलनानी ने पहले बोला कि N95 मास्क पहने, हालांकि बच्चे नहीं पहन पाएंगे, बट जितने लोग पहन सकते हैं उतना बेटर है। जैसा कि प्रोफेसर लालिन प्रसाद ने बोला कि पेड़ लगाने आवश्यक हैं, the more the merrier, and we adults have to take the onus. We cannot put the blame on the government or anybody else, क्योंकि गवर्नमेंट पोल्यूशन नहीं कर रही है। You need to understand that we as a human being, we as countrymen, citizens are doing the pollution, so we need to blame ourselves for whatever is happening, and we only have to do the rights.
सो जैसा कि एयर प्यूरिफायर का डिस्कशन हुआ है कि एयर प्यूरिफायर कैन बी यूटिलाइज ड्यूरिंग नाइट टाइम, हालांकि अभी साइंस इतना फेवर नहीं करती है, बट वी डोंट नो, साइंस इज चेंजिंग ऑन अ डेली बेसिस। आफ्टर 10 years पता पड़ा कि जी बच्चों में अगर एयर प्यूरिफायर यूज किए जाते तो आज यह स्थिति नहीं होती। अगर 10 साल बाद ऐसी स्थिति आएगी तो तब तक समय निकल चुका होगा। Therefore, if at home sleeping at night time, I would recommend parents, those who can afford to use air purifiers. Again, एक एक बूंद से घड़ा भरता है. So using things like agarbattis and also have been attributed. So agarbatti, धूप वगैरह का during this season when air is already super saturated with pollutants, जितना less करें उतना better है. अपनी vehicles को properly maintain करें. If possible, can ride a bicycle. यूज ऑफ रिसाइकलेबल बैग्स, जैसा कि प्रोफेसर ललिन प्रसाद ने बताया कि एनवायरनमेंट का अपने को उतना ही ध्यान रखना पड़ेगा. एंड एज हैज बीन डिस्कस्ड कि हमें डाइट प्रॉपर रखनी है, हमें अपनी इम्यूनिटी बना के रखनी है. सो दीज आर द थिंग्स व्हिच आई वुड सजेस्ट व्हिच नीड्स टू be updated.
Yes, sir. I think that was a wonderful summary of all that has been said and discussed in this program during the past 1.5 hours. और इसके आगे बोलने को कुछ नहीं है, बस एक ही बात यहाँ पे बोलना चाहूँगा, जैसे डॉक्टर खिलानी ने शुरुआत में बोला था कि प्रदूषण की वजह से बहुत सारी और बीमारियां भी होती हैं, सांस की बीमारी के अलावा, जो बढ़ जाती हैं, जैसे हार्ट की बीमारियां, हार्ट अटैक, स्ट्रोक, कैंसर. सो हमें प्रदूषण हर हालत में रोकना ज़रूरी है. And I'm so thankful to all of you, to our esteemed panelists who took out time and who joined us and you shared your esteemed knowledge with us. I'm sure it is going to be very enlightening for our listeners. And I'm sure that the team of ASSOCHAM is making notes of all the suggestions that have come up forward by all of you, and I'm sure that we'll discuss. We'll forward this to Mr. Anil Rajput, and ASSOCHAM will do its best to forward these suggestions to the concerned persons in the government of India also. And I think this needs to be done, and maybe we would request more contribution and more suggestions from all of you. So once again, thank you so much on my behalf of and on behalf of ASSOCHAM and on Shri Anil Rajput ji. आप सबका
Thank you.
बहुत बहुत धन्यवाद.
Thank you.
Thank you, sir. Thank you, sir.
Thank you.
Thank you, sir. Thank you, Dr.